So communication is 60% nonverbal, so it's really hard to talk about it. It's better to show it, but we're going to talk about it. I took the liberty of changing my title to maximizing the physician-patient relationship in a 15-minute visit, because the reality of medicine in the United States is that the average time physicians have with a patient is 15 minutes. Okay? So we need to see what we can do in 15 minutes. And what I would like to do is show you that we can do a lot in 15 minutes. I was going to touch briefly on historical perspective of this relationship. Why does it matter? What makes it therapeutic? What are the ingredients? Can we find a specific ingredients? Is there anything evidence-based that shows what is it that we need to do in that relationship or in that 15-minute encounter that will make a difference? Or is it just art or soul of medicine? What can we do during a 15-minute visit, and what is the future of this relationship? So the physician-patient relationship has been, and it still is, a fundamental aspect of medical care. There's no doubt about that. It's the core of care we provide. And I want to argue it's probably the strongest therapeutic and the most versatile tool we have as physicians. In our careers, we conduct roughly, most physicians, between 120 and 150,000 interviews. This is clearly the most commonly used procedure, if you would, that we practice, okay? The medical interview. Traditionally has been treated as sacred and legally and morally bound. And there's good evidence that sharing of information as patients, it's a vulnerable experience and frequently involves and even may require the revealing of our innermost selves in the course of seeking medical care. And what's interesting is that it seems that that process of revealing is the core of the healing in the relationship. I think there's no doubt that through the centuries, this relationship has changed a lot. And the way I'm seeing it in the 21st century is that there are multiple factors that are affecting and endangering, if you will, that relationship. Think of the internet and the impact it has on how we communicate. The aging population in the Western world. We live much longer. Chronic illness is much more prevalent. That puts incredible strain on our health system and also changes the relationship. Changing social norms. The public perception of physicians and illness is very different than 20 years ago. Government regulations, and different other regulatory body, FDA. New technology certainly interferes with how much time we spend with the patients and how much time we spend testing. The escalating cost of medical care and the dropping reimbursement rates for physicians all alter this relationship in many different ways.